This is your video on hypothyroidism. Since we talked about hypo is basically just the opposite. Think about when you're pushing that gas pedal, you let off the gas pedal and everything slows really far down. It's kind of like, having surgery and being put under anesthesia. And you know how we've talked about everything in the body slows down, your digestion slows down, your colon slows down, your respiration slows down. Well, that's approximately the same thing with hypothyroidism. It is affecting your metabolic rate. And since it's affecting your metabolic rate so much, then everything just really starts to slow down. So you get your thinning hair loss, loss of eyebrow hair, an enlarged thyroid, dry and very coarse skin, a slow heart rate, poor appetite, very cool extremities and swelling of the limbs, carpal tunnel syndrome. Women have trouble with infertility and heavy menstruation, and you can also have weight gain and poor memory. These particular patients have a lot of trouble with feeling tired. They can't think about things. Like I said, everything, including the central nervous system, has slowed down significantly. So we've already kind of talked about signs and symptoms. As I stated, your hypothyroidism is a result of a decreased metabolic rate. You might ask, well, what causes this? Well, number one, you have low levels of your thyroid hormone. And this can happen for several reasons. You may have the thyroid cells, they're functioning, but that person may not be ingesting enough of the substances needed to make the thyroid hormones. Those things like iodine and tyrosine. Sometimes when the production of the thyroid hormones are too low or absent, your blood levels of thyroid hormone are very low, so that's what makes the patient have a decreased metabolic rate. You may have the thyroid cells may not produce sufficient levels of the thyroid hormones, is another reason to have it. And sometimes the cells are just damaged and they no longer function normally. So we'll talk a little bit about myxedemia. This picture here shows what a person with a myxedemia would look like. They have the dry, coarse, sparse hair. The lateral side of the eyebrows, that's the outside, are thin. They'll have periorbital edema. It looks like they have a lot of swelling around the orbits. And then they'll have puffy, dull face with, again, that dry skin. Myxedemia coma is a medical emergency. It's caused by untreated hypothyroidism, or a hypothyroidism that has been poorly treated. The patients either aren't taking their meds, or they're taking them in an inappropriate time, or they're not having their lab work checked to make sure they're on the right dose of their thyroid medication. And the metabolic rate, because it is so low, causes the heart muscle to be decreased and kind of be flabby. The chambers start to increase, so you start getting cardiomegaly. You have decreased cardiac output. You have decreased perfusion to the brain and all of your other organs. And then this just starts making the fact that your metabolism was already slow, so it starts getting worse. This results in tissue and organ failure. The mortality rate for myxedemia coma is extremely high, and it can be caused by a number of events, drugs, or sometimes any other conditions. Most of the cases that you see of hyperthyroidism occur as either a complication from thyroid surgery or from radioactive iodine treatment for hyperthyroidism. They do use radioactive iodine treatment a good bit for hyperthyroidism. And again, like I said, that is actually an oral pill that the patient will take. Hypothyroidism can occur most often in women between 30 to 60 years of age, and they're affected 7 to 10 times more than men. There is a chart on page 1292 which lists all of your signs and symptoms. It also lists the causes of hypothyroidism. So make sure you look at that. Just some assessment signs. Some of these symptoms may come on very slow. For these patients, they may report that, they may just be getting a lot more tired, or they may be sleeping a lot, sometimes up to 14 to 16 hours a day. They have generalized weakness, muscle aches, paresthesias, constipation, and cold intolerance are common. Both sexes may have a decreased libido. There are infertility issues, and then men have problems with impotence and fertility. And you want to ask, if they've ever been treated for hyperthyroidism and what that specific treatment was. Also talk to them about the current use of medications they're on, because some particular medications can impair the thyroid hormone production. A lot of cardiac drugs can particularly affect the thyroid gland. You want to look at their overall appearance. Again, they're going to have coarse features. They're going to kind of look like this man on the picture here. They may not speak clearly. It may take them a longer time to respond to questions. Cardiac respiratory functions are decreased. Their heart rate's going to be low. Their blood pressure is going to be low. Their body temperature is often lower than 97. Weight gain is very common. Even though this patient is not overeating, they will still have weight gain. Depending on the cause of it, the patient may have a goiter with this as well. The presence of a goiter does suggest a thyroid problem, but it does not suggest whether it's excess or too little. Depression is the most common reason for these patients seeking medical attention. And then again, with your laboratory findings, your T3 and T4 are going to be decreased. Your TSH levels will be high in primary hypothyroidism, but they can be pretty much normal with secondary hypothyroidism. And patients older than 80 will have a lower than normal level of thyroid hormone without any signs and symptoms of hypothyroidism. And then they would not use hormone placement with that until they start exhibiting signs. If the hypothyroidism is chronic, the patient may have cardiovascular disease, so we need to do a lot of education for these patients on reporting chest pain, reporting on chest discomfort. When we start thyroid replacement with these patients, they do require lifelong thyroid hormone replacement. The most common is levothyroxine, like Synthroid. They start with pretty much the lowest dose they can. They gradually increase it over a period of weeks, and they'll do blood work periodically to make sure that they have them on a right dosage or whether they need to increase it. If a patient has extremely severe symptoms on hypothyroidism, then they definitely start them on the lowest dose available. If a patient has already pre-existing cardiac problems, starting at a higher dose can cause their cardiac problems to be more severe. It can cause hypertension, heart failure, and an MI. So education is extremely important in these patients. They need to take their thyroid hormone at the right time each day. They don't need to change their dose or schedule without consulting their physician. And they also don't need to change brands, because different brands can affect patients in different ways. Most thyroid medicines tell the patient to take them at night, and I also know a lot of hospitals will give them like at 6 o'clock in the morning, because it's better for them to take them on an empty stomach. For the patients who are experiencing the myxedema coma, there's a chart on page 1294 that goes over the main focuses, which is maintaining a patent airway, giving fluids, IV glucose is needed, steroids, monitoring for changes in the mental status, and also aspiration precautions. The most important thing with these patients is just monitoring them, every 1 to 2 hours. So hypothyroidism versus the aging adult. We all know as we get older, things tend to slow down. So sometimes it's kind of hard to differentiate between whether this is a patient who has too little thyroid hormone or whether it's just a patient who is exhibiting these signs and symptoms from aging. As patients begin to age, or excuse me, people begin to age, you realize they lose a lot of they're not making as much as a lot of the hormones. So the thyroid hormone secretion is going to decrease with age, but the hormone will remain stable in an older adult because where it's stored, how they clear that of the hormone, it also decreases with age. Their basic metabolic rate is decreasing, so they don't quite need as much of the thyroid hormone. And also, if that patient is older, they're going to require a lot lower dose of thyroid replacement than somebody who is 30 or 40 years of age. And that's because the heart muscles are starting to not be as firm as they used to be. It could affect the heart muscles. So, we have to be extremely careful with the aging adult and the diagnosis of hypothyroidism. Well, that is it for this video. Have a good evening.